Good afternoon and welcome to the arena on Aneke TV. Today we shine a light on a health issue that often goes unnoticed until it's too late. Oral head and neck cancer. You know, it's more common than many people think, and the earlier it's detected, the better the chances of successful treatment. So let me just shed a little light on oral head and neck cancer. And this refers to a group of cancers that starts in or around the throat, larynx, that's the voice box, node, sinuses, and mouth. Now, these cancers typically originate in the squamous cells that line the moist surfaces inside. So today will be the moist surfaces inside the head and neck, such as mouth, nose, and throat. Now, Oral Head and Neck Cancer Awareness Week is actually celebrated in April. Specifically, the Head and Neck Cancer Alliance designates April 16th to 22nd as Oral Head and Neck Cancer Awareness Week. But then, the World Head and Neck Cancer Day is celebrated on the 27th of July of every single year. So joining us today is a very important personality. He is Dr. Uchenna Okechi, an associate professor and consultant oral and maxillofacial surgeon, UNTH and UNN here in Enugu State. Good afternoon, sir. It's good to have you on the show.
Good afternoon.
All right, so he will help us understand what this condition is, how to spot the signs early, and what we can do to prevent it. So if you or someone you know has experienced unexplained sores, lumps, or difficulty swallowing, you will want to stay tuned to the arena on Aneke TV. Welcome once again, sir.
Thank you, Amaka. I'm pleased to be here.
All right, so moving on, let's move over to our question, our first question for today, talking about oral health, oral head and neck cancer. I would like you to tell us what this is all about. A lot of people do not even know that there is something called oral head and neck cancer. So please enlighten us. What is oral head and neck cancer?
Okay, thank you. Once again, during your introduction, you're able to, just browse over it. Then, oral health, oral head and neck cancers are just cancers like any other part of the body. But when they occur within the head and neck region, they are now called oral head and neck cancers. Okay, so they can affect any part of the orofacial, you use that word, oral and facial region. And the orofacial region is a very important part of the body. Important in so many aspects. Aesthetics, that is, the face is normally the first place people look at, especially for female. Look at when you see a female, you try to assess the beauty from the face. So it's an important place. That region has where you feed from, you feed through, then speech and all those. So functionally it's very important, aesthetically very important. So when you have a cancer affecting that region, from the mouth down to the throat, we call it oral and head and neck cancers. Okay. Head and neck cancer is a broader term. There are oral when it's within the orofacial, when it's within the facial and mouth. Then if it goes beyond that, it becomes head and neck.
All right, okay, that's okay. So I want you to tell us how common this type of cancer is. Many people do not know about it. So I want you to tell us how common it is in Nigeria, in Africa, and of course globally. How common is this cancer?
Okay, so thank you for this question. Oral and head and neck cancers are they are very, very common, but people tend to, or the government tend to neglect it, in the sense that it is not, attention is not given to it as much as it is given to other cancers of the other parts of the body. There are, of course, when we talk about some cancers now, you already know about them. When you hear cancer, there are some places that will strike your mind first. So, but this oral head and neck cancers are very, very prevalent. They are common. Studies have shown that about 5 to 10 cases, or 10 persons in 100,000 have it, or have new cases every year. So about that will amount to about 300,000 new cases every year. Then when you now compare it to other cancers of all the other parts of the body, is the sixth commonest. The sixth commonest. Then, well, in Nigeria, a number of studies have been done. However, there's no central study that we can say that this is the prevalence in Nigeria. But studies have been done, and it ranges from 20 to 40, over 40% of cancers in the country. So it's a very, very common cancer, but like I said earlier, the government doesn't really pay much attention to it as much as they pay to other cancers.
Based on the prevalence, are there any age limits? Are there any specific age groups that have been affected by this particular kind of cancer?
Okay, in the past, it is attributed to elderly people. So people within 60s and above, in the past, that is when you hear cancers, or especially facial cancers, you think of elderly people. But these days, the trend has changed, or is changing rapidly. The trend is changing. Now you can see young people as young as 20 in their 20s, 30s, coming down with.
You know, some days back, I was actually going through this, and I saw a video of a young boy of about 13. He's not a Nigerian though, he's an Indian. And I saw this very heavy lump on the neck. So that just put my thought to, okay, this could be a kind of a neck cancer. It was a very large tumor. So I think it's affecting even children who are below the age of 20. Or what do you think?
Yes, you know when we use the term cancer, there are a lot of conditions, malignant conditions that are cancer. So there are some that are commoner in children, young children. However, there are other tumors, swellings that may not be cancer. So except there is a histopathological report after biopsy is done, and then the pathologist term it a malignancy or cancer. Then you can say that it's a cancer. But just mere looking at a picture does not tell you, except you read the history, and then there is a histopathology report that give a definitive diagnosis of cancer, then you can term it cancer.
All right, so moving over to some causes and risk factors, because I know definitely there is no smoke without fire, they would say. So what are the main causes or the risk factors for oral and neck cancers?
Okay, there are, before we talk about the risk factors, there are different types of orofacial and head and neck cancers. There are different types. You have the one, like you mentioned, you have the ones that affect the epithelia, lined structures like hollow organs, and then you have the ones that are from connective tissue. So the epithelial line, the ones originating from epithelial line structures are called carcinomas, while those from connective tissues are majorly sarcomas. There could be others. There are some blood cancers too. So most of the carcinomas are attributed to lifestyle and habits, like smoking, alcohol use, and then there's some from virus like Epstein-Barr virus and papilloma virus and also. So those are, but the sarcomas, majorly, we cannot really determine. Studies have not really concluded the source of the, but like I said, for the carcinomas, lifestyle and habits are majorly attributed to the causes of.
Okay, yeah. All right. So what are the early signs? What are those signs you think people should look out for? When they start getting symptoms, what are those signs you think people should look out for them to go for early treatment before it goes into full-blown cancer?
Okay, when you have a wound, an ulcer in your mouth or your facial region or a neck, let's say ulcer in the mouth, let's start from the mouth, anywhere, 2 weeks, 3 weeks, and the ulcer is still there, non-healing. You have doesn't feel much pain, it may not be painful, then it's an indication for you to seek medical advice. When you have swelling within your facial region, and there is no source of maybe you look around, check everywhere, no ulcer, no infection, then you need to consult your doctor. Then some of them comes with, like I said, swelling, then there's what we call paresthesia, abnormal feeling or sensation within, especially tongue or any part of the, you don't feel, it's not feeling normal the way it should feel. Then it's a cause for worry. Then you have bleeding, persistent bleeding, or just bleeding from unknown reason, from the nose, at times occasionally from the mouth. You need to look out for the cause or the source of that bleeding, and so you need to present early. But unfortunately, in our environment, people hardly present early, except when it has gone very, very far.
So you're saying sometimes people don't even notice the symptoms. The symptoms are not even there. They just wake up one morning and they discover they have cancer. Is that what you're saying?
Yes, it could happen that way.
Oh.
You can wake up one day and see an ulcer in your mouth. And of course, when you see that kind of thing, the first thing that will occur to your mind, maybe it may not take it serious, it will heal. But that's why I say 2 weeks, 3 weeks is still there. The size has not really increased much, it has not reduced. It's a cause for you to check it out. Then you have a swelling somewhere in your head and neck region, swelling gradually increasing, or did not increase much. You left it for a while or for some years, and then suddenly started increasing, or pain sets in. Then the final symptom is pain. At times you may not even have all those symptoms, but you're having pain somewhere.
Oh, wow.
So you need to check it. Then there are other signs like patches, red patches, very important, red patches, then white patches, leukoplakia. There's something we call pre-malignant lesions. So those things are not really cancers, but if you leave them, they will progress. So those pre-malignant lesions, red patches, white patches, they are not painful. They are worrisome.
All right. Okay. I hope you're having fun. I hope you're learning something. If you are not, I am. Stay tuned. It's still the arena on Aneke TV with Unbroken. And right beside me is Dr. Unbroken, who is a professor and consultant, oral and maxillofacial surgeon from UNTH and UNN Enugu State. Do not go anywhere. We'll be right back. We are back, and you're still tuned into the arena on Aneke TV with Unbroken, and beside me is Dr. Unbroken, who is a professor and consultant, oral and maxillofacial surgeon at UNTH and UNN Enugu State. So moving on, we're talking about the oral head and neck cancer, and we've said a whole lot. Not me, Dr. Okechi, actually, I said a whole lot about this cancer. So we'll move on to the routine screenings. We're going to talk about myths and facts, and after that, we'll talk about treatments and possible diagnosis for oral head and neck cancer. So over to you, doctor. It's good to have you back on the show. So we're talking about routine screenings and checkups. So are there any routine screenings or checkups that can help with early detection?
Yes. Thank you so much for the question. Oral head and neck cancers can be screened for early detection. Okay? So there are methods, there are different methods that you can apply. But the basic thing you do first is clinical examination. So you look at the person physically, you examine the person. Then, of course, like I earlier said, there are early stages, pre-malignant stages. So some of them you may not even detect them by examining, looking at the person, just looking at the person alone. Then you can use further aids, like there's what we call toluidine blue. You can use it to, just like a mouth rinse, you rinse it. There are process or procedure, but what it does is to pick early stage, very early stage, to pick it, to stain it. If there's any malignant or cancer cells there, to pick it early. Then, however, the sensitivity may not be very, very high. Okay, so there are other things like you can use fluoroscope or fluoroscopy to detect them. And so, but those advanced, then you can also use some other advanced imaging technique, like MRI and CT scan.
Okay.
Though MRI is higher, so but they can actually, but those ones are when you have like suspicion that, though you may not be seeing it fully, but you feel that strongly that there may be something going on there, you can then request for those ones. But for the early stage and for the low cost screening, you use toluidine blue stain.
Okay, so moving over to some myths and facts about oral head and neck cancer, could you tell us some of the common myths? Some of the things people say, this is what oral health and this is what oral head and neck cancer is all about. What are those things that are not true about this kind of cancer that needs to be corrected?
Okay. In our environment, the first thing I can think of now is, is a common thing that many people, and it's very misleading.
Okay.
Many people tend to uh, practice it. You feel that somebody has attacked you. You say spiritual attack.
They say it's
That is a
village people.
spiritual attack. Yes, or your village people have attacked you. So you feel that somebody is chasing, is after your life.
Okay.
So it's not correct. Even though people may be, but from what we know, it's not really spiritual or any. So those things are not. They are myth. Some of the myths. Then, like I said, habit is also one of the important things that we look at.
Okay, and then talking about habits, you talked about people who smoke, smokers and alcoholics, right? But then I want to ask, is it possible that non-smokers and non-alcoholics can also get this kind of cancer?
Yes, I said it. Non-smokers can get cancer. And of course, there are different types of cancer. So it depends on the type you are talking about, or the type of the person. But even the squamous cell, the carcinoma that are attributed to lifestyle habit like smoking, and young people, many people still come down with it without even tasting alcohol once or smoking. So those kind of cases, you don't know how they happen to come by, but it can happen.
So let's move over to some of the treatments for this kind of cancer. So what are the current treatment options for oral hair and neck cancer? Are there any treatment options for them?
Okay, so like we've never talked, we didn't talk about it. The idea for treatment is prognosis. What will guide your treatment is the staging, at what stage the patient presented,
Okay.
and then the prognostic factors, what will you achieve, or what you aim to achieve after the treatment. There's what we call 5 years survival rate.
Okay.
So when you treat that patient, how long can that person live after the treatment? So they normally use 5 years to assess. The first 5 years, can it get up to 80, 100%? As in, the person can live normally for 5 years. Then you talk about 10 years. So those are some of the things that will contribute to the type of treatment. And then the important one again is the stage at the time of presentation. Then if the person presents early, of course, you aim to treat,
Okay.
to curative. If the person presents early, there are options. We have 3 major options: surgery, chemotherapy,
Okay.
radiotherapy. So there are these are the basic ones. There are other options beyond these 3 that are being tried. In the Western countries, there are other advanced gene therapy, immunotherapy, so many other types of therapy that you can use to treat and achieve very good results.
Okay.
However, those ones are very, very expensive. But in our environment, what we normally do is surgery. Then you can use chemotherapy, which is like using chemical agents to kill the cells. Then you can use radiotherapy, which in a layman's term, we say in Igbo we say ichoku. The cells will die. But that is radiation. Okay, so the radiation can can kill these cancer cells. And let me add again, unfortunately, radiation too can lead to cancer. So, so.
All right, so because of time, let's just rush through the last two questions I have for you. So, based on talking about supporting these these patients with this kind of cancer, what kind of support do you think they need typically? Is it financial? Is it emotional, psychological? What kind of support do you think these patients really need for them to be able to go through this particular phase of life?
Okay, thank you again. So, like why I said the orofacial cancers are not normally brought to the limelight like cancers. There are some cancers that you hear about. Those ones get a lot of support. You have, let me start with foundations. You have organizations that offer sponsorship and everything, but you hardly hear about head and neck cancer support. Even in the hospital where I practice, there are cancer revolving fund and stuff like that, restricted to some specific cancers, but head and neck is not part of it. So those people will require a lot of financial, because money treatment is very, very, very expensive, and apart from the surgery, other treatment modalities, they are very, very expensive. Then, of course, like I earlier introduced, the head and neck region is very important place. When you do, especially when patients don't present early and you do your surgery, surgeries are normally radical. You try to remove as much as you can, and in the process you have a lot of defects. You can remove the part of the face, a big part of the face, create a light defect that will cause aesthetic problem. The person won't look normal again. The person may not be able to feed well again. So those things cause a lot of psychological problem. So you see them going into depression. So they will ultimately need psychological support.
Okay, so our last question, this is like the last and final part of it. So what's your important message to the public? We want you to address the public. Just tell them, what do you think is the most important thing they should know about oral head and neck cancer?
Okay, so thank you for this opportunity. I want to tell our people that head and neck cancers are very difficult to manage. They are difficult to treat, especially when the patients present late, if you don't come early. And so how will you know that you have it? It's only when you come to the hospital. In UNTH we have a center, oral maxillofacial center, where you have resources and manpower to treat these kind of conditions. So early presentation, once you see something within your head and the head and neck region, pain, swelling, abnormal sensation, ulcer, and you watch a little while it is not healing, please, instead of going to a spiritualist, to a pastor or a prophet, I'm not saying those, God can heal somebody, but it's better to seek medical help early. Let's come and look at it and say, I want to know what is happening to me. At that early time, a lot of intervention can take place and prevent future complications.
All right, and there you have it. That was truly, 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 truly enlightening. That was an enlightening conversation on oral head and neck cancer. And remember that early detection can save lives. don't ignore persistent symptoms and make routine checkups a habit. A big thank you to our guest, Dr. Uchenna Okechi. It was nice having you on the show. I learned a whole lot from this particular interview, I would say. So thank you for sharing such valuable insights though, and let's continue to spread awareness, supporting those affected and making health a priority. Thank you for watching. Join us another time on the Arena on Aneke TV.